Good afternoon, and welcome to October. Can you believe it? The October Medical Monday. And as you can see, today we're talking about breast cancer. So look at all the pink. And we have a couple newly diagnosed breast cancer people in our audience, as well as some breast cancer survivors. And you'll probably hear from them. But first, we have our breast cancer navigator, Krogman. And Casey is freshly off of maternity leave.
Day 2. So if I'm rusty, give me grace. No.
And I told her she had to have pictures of the new baby in her presentations.
I was going to add one at the end and then it slipped my mind, but I'll make it right.
Okay.
I'll make it right.
So without further ado, here's Casey.
Hello, everyone. So happy to have you all with us here today. I know, there we go. That sounds a little better. Happy to have you all with us here today, especially those who are survivors. You understand what, unfortunately, firsthand, what it takes to go through a breast cancer diagnosis. And unfortunately, it sounds like we have a couple of newly diagnosed women here, and we are definitely thinking of you and here for you for questions and just support, honestly. So just kind of wanted to run through things as far as the awareness of breast cancer. Of course, we all know what it is, but there's a lot of specifics that we don't think about and just sometimes don't have the common knowledge of, or sometimes thankfully don't have that firsthand or even secondhand experience with. So just kind of wanted to do a run through of things together and take time to just discuss things and bring up any questions or concerns. A lot of the information can kind of be misconstrued, or different organizations have different recommendations. Sometimes it's just that that's not clear on when to do things or when to stop things. Like people ask about mammogram ages, things like that. So this is just kind of how we feel as far as the Reid Breast Center, and we take into consideration, of course, the national guidelines. That's our minimum, but sometimes we have further discussions based on the patient. So just kind of wanted to run through things and review things with everyone. On then. But no, like Sherry said, I'm Casey Krogman. I've been at Reid about 10 and a half years now. I've been an oncology nurse for most of that time. I've worked with inpatient oncology patients, sometimes hospice patients, transferred to IV chemotherapy, and did that for a while. Really enjoyed that, but it was time to get away from some of those hands-on things when it came time for babies, like she said. So just coming back from that, I've now been the breast cancer nurse navigator for about 4.5 years. Just last year, I completed my CBCN certification. So it's a certified breast care nurse. Essentially, when you've been in the role for a while, you're challenged to take an exam, study and take an exam to show your certification in the role and kind of in the topic, essentially. So that was just something new this year. Just wanted to update some breast cancer statistics. Unfortunately, these numbers are growing every year. I kind of use the same format for my presentation every year when I do a different presentation in October. And I try to find updated statistics for the current year. And unfortunately, every year when I update it, I'm having to increase those numbers. So had to add about 50,000 to this year's statistics. So it's pretty fine print. Just a couple of highlights I like to share. This year in the U.S., 376,030 women will be diagnosed with breast cancer. That's of all stages, and that's just, of course, very alarming. Typically equates to 13% of the population, or what we commonly refer to as 1 in 8 women. I'm sure everyone in here knows someone, if not multiple family members and friends and loved ones. So just to highlight that unfortunate statistic. Did want to point out a couple more on there. Breast cancer accounts for about 30% of cancer in women. About 85% of diagnoses occur in women with no family history of breast cancer. And I think that's an important statistic because we think family history a lot of times, and we focus on family history, and it's very important. And sometimes family history and with our patients leads to further testing, like genetic testing. But the huge majority of our patients have no family history, which unfortunately kind of feels like a safety net sometimes. Like women show up for their yearly mammograms, but they might not have as much of a sense of, unfortunately, dread or worry as much that they could have breast cancer just because they don't have family history of it. So many diseases we talk about, we know the importance of family history and we know the statistics, but this one is just one that family history is very important with it, but it happens to most patients without any, and I think that's something to highlight on, because a lot of times it's just always thought about to being a family disease. While it is, but it is also not. Just some specifics on there. There is some good news as far as we're seeing more and more numbers every year, but also seeing more survivors. People are living through it, living longer, having kind of a better prognosis of things, and a lot of times that's because it's being caught at an earlier stage, because staging truly matters. About 65% of breast cancer cases are diagnosed at a localized stage, which they consider the 5-year survival rate to be at or greater than 99%. You'll see some statistics even say 100%, but most resources are a little conservative to actually say 100%, but you'll see greater than 99% on a lot of things, which is amazing. And that still can take a lot of different treatment, almost always surgery, a lot of times radiation, sometimes some chemo, a lot of times a hormone manipulating medication. So even going through all of that, the statistics are still that good with being caught early, which most of the time is only being done on a mammogram. Just a little information on the stages. You'll see the vast difference in the statistics there with things being caught early, again, being greater than 99% of that 5-year survivor rate, which is how they kind of rank things there. Stage 0, sometimes they call it a pre-breast cancer. It's technically a breast cancer that hasn't invaded the surrounding tissue. You might hear it called DCIS. It's essentially before it branches out further beyond the original area of breast cancer cells and kind of gets into the breast tissue at all. So that stage 0, the stage 1, that's where we're gonna catch it most of the time, and we hope to catch it most of the time, and that's why we just say come every year for your mammogram. That way we can kind of catch things, because things unfortunately do grow fast. We see people that come every year and something has happened in between that time, or sometimes even a smaller time period, but just kind of keeping an eye on your health and just making sure you're showing up for your screenings is really the only way to catch things. We can reduce risk, which we'll kind of get into, but unfortunately we can't prevent this. And then you see those statistics drop off as it spreads, which most of the time is just as time progresses, with it being not found, not diagnosed, not examined from not coming in, or just growing quickly in between exams, or unfortunately if there's some kind of issue as far as it's not taking to the treatment that's being prescribed, or someone's not a fit for treatment. You see that kind of just as things progress, of course, the statistics really decline. Talking about annual mammograms. So every single year we really want to push for every woman to get a mammogram. The statistics are just, they speak for themselves. Now, most of the recommendations are pretty clear in starting at 40 for every woman. There are some women that need to start sooner though. So the recommendations are at 40, or if there's family history, especially if they've had a younger family member, like maybe before 50, we say 10 years younger than their youngest family member that was diagnosed. So of course, if someone was 49, 48 at their diagnosis, their family members should start their mammograms at that 39 or 38 mark. So that's just something to keep in mind. We do have women that come in their 30s, sometimes even without that family history, but they just see it. And unfortunately, we see younger and younger women coming through with this. And so they will just kind of push for a sooner diagnostic mammogram, and a lot of times it is covered from their insurance. So that's something that they will discuss with their doctor, but the national recommendations are starting at 40, going every year, and technically there's not an age to stop. So that is something that sometimes you almost hear something different from everyone you talk to. They used to say stop at 75 or stop at 85. Sometimes the fine print says, you know, if you're in good health and expected to live at least another 10 years, continue your mammogram every year. We, of course, don't have a crystal ball on things for our life, and we hope to just, you know, live and stay healthy and keep doing well. But technically, there's not an age to stop, especially if you're, you know, still feeling well, getting out and about, and would be able to do something to take care of any diagnosis that could have been found. We recommend definitely still coming every year. And that's something that people even still to this day say, well, my doctor told me I didn't have to come, and so I stopped when I was 80, and here I am at 85 because I feel something and I've got something growing, and now I have breast cancer. So that's just something it's almost a gray area because there's not a definitive stopping date, but we say, hey, keep going, unless someone would be to the point where they're unwilling to try anything, even a really small treatment, as far as on the big scale of things, then we say keep coming for your yearly mammogram. I think most women in here hopefully have had their mammogram, maybe even most of them having had it already for this year. But a mammogram, we show up and we have a great staff, just again talking from the Reid Breast Center, but we have some comfortable robes we'll put you in. You will be undressed from the waist up completely. We ask that you skip deodorant and lotion in that area, to skip the lotion in that area. Just because it could technically interfere with some of the imaging. You'll go back and have typically just a couple of images taken per breast. That'll take a few minutes. There is some discomfort. I know that pain is often a fear of a lot of women, understandably. Sometimes it's a deterrent for getting women in for their mammogram, even their first one, the unknown, or people that have had pain before on a previous mammogram. But that discomfort should go away very quickly after a mammogram, and unfortunately that discomfort is worth it as far as the risk versus benefit, discomfort. And I know sometimes people have concerns about radiation exposure, but they say that a mammogram's radiation exposure is so minimal, it's less than being outside for a certain amount of days. So they say that it's always worth it, obviously, unless there was something going on, otherwise in someone's health. But after those images are taken, you'll be kind of allowed to get dressed and head back home. We do have a staff group of radiologists that read all of our reports, typically same day, a lot of times even within that same hour or so. So everyone that uses MyChart, it's going to be popping up on your MyChart. Sometimes by the time you get to your car in the parking lot. There are some women that have to come in maybe with their certain history from themselves or their family members, or if they have something going on, and they'll have what's called a diagnostic mammogram versus our yearly screening mammogram. So that is when we'll say, let's go ahead and have you wait and get that read while you're here, because there's something that they're specifically looking into, and they want to have that answer for you right away. That way, if there's any follow-up needed. But as far as screening and coming at once a year, you'll be in and out before you know it, and seeing those results come up. If you don't utilize MyChart, that's fine, even though we obviously encourage it for everyone. You'll get a result letter in the mail. It'll be clearly explained to you, and it'll also have some information, websites just to look anything up if their mammogram report talks about having dense breast or fatty breast, or just talk about breast health in general. That'll be listed on that report, and it'll of course go to your doctor or your provider that will talk to you as well. A lot of times, around 90% of every mammogram patient, they get to leave and have no follow-up until they're back the next year. But about 10%, we say, have to have some type of follow-up. So this would be for someone that's coming in for their yearly screening. There's nothing that they're coming in with as far as a lump or a recent history of an issue, things like that. And based on that result, they find something that just needs looked into further. And that's just takes different types of images. So the mammogram gives a great view of the breast tissue, but whenever something's found, it only gives so much detail. So the next step they usually like to do is a breast ultrasound. And our policy at Reid is to try to get you in within a few business days to get that turnaround time. We know during that turnaround time, for most people, it's just anxiety, the worry, the what if of what's going on that's requiring follow-up. And most of the time, there's no further follow-up needed, but we do recommend a breast ultrasound whenever something is seen that can't be like kind of visually ruled out by the radiologist. So if they see something and think it's beyond like a simple cyst, they like to follow up with an ultrasound, sometimes a breast MRI, which we are working on at Reid, getting that started hopefully early in 2026. So that way, if that follow-up's needed, women aren't having to drive to Indy or Dayton for that follow-up information. But about 10% of the patients that have to have the extra follow-up with the ultrasound, about 10% of them will have to have a consultation with one of our general surgeons. So you'll meet with most doctors, they'll kind of review everything with you, do a thorough exam of things, and then they're gonna most likely say, yeah, this is something that we're seeing, we need to know what it is. We have more specifics from the extra views and extra kind of quality from that ultrasound, but they kind of need to check things on a cellular level to know what's going on. So that's when they'll get you scheduled for a biopsy and get a sample of it to send to lab to get back an exact answer of what it is, what exactly is growing, and if anything, what to do about it. So they would talk to you about that. A lot of times those biopsies, again, it's kind of, they call it like the 10-10-10 rule, like 10% of mammogram patients have to have follow-up, 10% of the follow-up have to go on for the biopsy, 10% of the biopsy end up with a cancer diagnosis. So that's a very general statistic, but it just kind of reminds you that just because you have to have a follow-up, most of the time it's not going to lead to a bad result, it's just, it needs to be checked out. Just some information on self-breast exam instructions, which I know that they passed out back at the table too with the gift basket. So although this is no longer technically a recommendation from certain, just the national guidelines, all they really highlight is the yearly mammogram. We just recommend staying in tune with your body and looking for any changes. Sometimes there are women that feel something before their mammogram or even before they're seeing their doctor next. I had a reminder here, unfortunately. There's something called inflammatory breast cancer. Pretty low statistic, but it's very important. Thank you for reminding me of basically the really bad statistics when it comes to things. So glad to hear that your daughter is doing well with her previous history, but it's important to know that staying kind of in touch with your body and looking for changes can sometimes be something to look into before your mammogram. So changes to the skin, an abnormal rash without incidents or new lotion, things like that, just tissue changes, obviously lump we always want to check out, but sometimes it's just a change in the tissue of the skin or a change in the nipple, and maybe it's kind of looks different than it used to, or like we call it inverted a lot of times. So just things to kind of keep an eye on, just to know your body and to know when there have been changes, because a lot of time a change warrants some type of follow-up as far as, okay, let's look to see what's going on there and have a mammogram. Even if you've already had one, that's when they would order something more diagnostic to look into things. So this is just a reminder, just to keep an eye on your body, know yourself, to look for any changes. So it talks about just looking in a mirror, looking for tissue changes, different angles as far as raised arms, palpating the area, kind of thoroughly examining the breast, even kind of going into this armpit area. That's an important area not to forget, kind of go all the way through. And a lot of people say, well, all I feel is lumps anyways. And I like to say, well, if you feel a lump, hold your spot there. Take your other hand, go on the opposite side, try to match that side. If you feel the same type of lump, then maybe you can write it off as just that's the way your breast is and that's the way your tissue is. Not that that's definitive, but if you feel something that feels way different than the surrounding tissue and can't find anything on the opposite breast that feels like that, that's definitely a sign that there's something different in one breast than another, as far as a sign to talk to your doctor about. A lot of women like to do this in the shower. The slippery surface kind of helps with the feeling around, and kind of a good reminder once a month. Talking about breast cancer risk reduction, for the most part, like we said, we can't prevent things. When it comes to this, it's about reducing risk. And just like with most diseases, just staying healthy, knowing your body, decreasing alcohol, exercising, eating well, reducing maybe some risk that you might be exposed to as far as smoking or any type of substances. They excuse me. They talk about understanding your hormones and birth control options, just different questions to come up as far as sometimes they talk about hormones and it being a negative thing, especially for women that might have went through menopause and are having symptoms after that and have started taking supplemental hormones. A lot of providers say no to that when there's a family history of breast cancer, just because if something would be going on, sometimes those extra hormones can just feed that cancer. So just a lot of general things as far as keeping your health, keeping your health in check and just knowing your body, but also kind of considering what your history is and what your family history is, and kind of making those decisions for yourself. Again, we've got the My Chart where you can schedule that way for just your regular screening mammogram. You can go online, you can call, even going in person. You can almost schedule anyway for your yearly mammogram. And then again, if there's something going on where it's in between those appointments, or you've got a new concern, you just call your doctor's office or your nurse practitioner's office and talk to them about what you found or what you think might be happening, so that way they can get things checked out to see if you need something sooner than your next exam. No baby picture, sorry. Thank you guys so much.
Thank you, Casey,
Yeah.
Maya, and Jackie. Thank you. Next, we have Sarah McCashland, who's here to talk about Firefly and the Family Resource Center. And you probably passed it as
Sorry.
Firefly on North 12th Street. It's the yellow building. It used to be a Head Start building. So without further ado.
Hello, everybody. I'm going to follow that harder discussion. This is not as heavy. But I want to thank everybody for letting me come in today and speak on behalf of the Family Resource Center. Like she was stating, Firefly is our umbrella company. So Firefly does a lot of great services. They do a lot of home-based, community-based things. While the Family Resource Center, we are more center-based. So families can come in, utilize our space. We have a lot of great things that we've been offering. We've been there now 2 years. We just had our second birthday in September, so we celebrated a big party out there. So, has anybody heard of the Family Resource Center? I always like to lead with that. Ooh, I got some hands. So, a lot of you haven't heard of it. So, you're going to learn a lot then. So, Family Resource Center. So, like I said, we're only 2 years old. But I have some just real basic data for you today. I won't bore you with a lot of data, I promise. But just for the 2025 data so far, as of September 30th, we have served over 773 individuals, and those are just people coming into the center getting resources. So those are just our walk-in traffic. And then our outreach events, where we go out in the community or just do our own events at the center, we've served about, 1,442. So as you can see over the past 3 years, how our numbers have been climbing. So the first year we started in September, so we had a very short year. As you can see, we had 39, but we grew up to 900 last year, and we're already at 778 for our daily attendance, or 73, sorry about that. And then our events, we've already exceeded and went over the amount of people we've reached through events. So we're continuing to grow, and we're excited about that. So what we do, for the individuals who haven't been there, never heard of it until just now, like I said, we are a small little tiny house. Anybody familiar with the old Townsend Center? Okay, there was a Head Start that used to be across the street in a little tiny house. That's where we're at. So we're over there on North 12th, and during our business hours, we're open from 12 to 5, Monday through Wednesday, and then 12 to 5:30 on Thursdays. Families can literally walk in and we can help them get resources. So we do service families with 18 and younger year-old children in the home. That is our main population, so we get our grants for. So they come in during that time though and sit down with somebody, and we literally will help them navigate local resources. We'll help call with them, we'll help fill out forms. We just really want to get them connected and just do a lot of those, kindness, warm handoff type situations. We also offer safety items. We have what we call a Susie store on site that has hygiene items as well as food. We do have make and take meals that families can utilize once a week. The hygiene items are once a month. And then we also offer the family fun events. We do community initiatives, parent connection, education services, and mobile services. I'll break those down a little bit more on my other slides. So family fun events. The flyers there are just a few examples of some of our more popular events that we've had. Every event we offer at the center is completely free for families to attend. So inside the purple folders, you'll see calendars. There's November and there is October in there for you. Any event that you see on there listed, I know coming up here in October, tomorrow we're doing pumpkin painting. We're doing a spooky party at the end of the month because we don't want to do a scary Halloween party because we have a lot of littles. So it's a not so spooky party. And then later in November, we're going to be doing more things around education series around make and take, like crock pot meals. We're going to be offering Thanksgiving fixings for families to come in and get a bag of fixings, so they pretty much just have to worry about the turkey, because we know a lot of people are struggling with food insecurity in the community. And we're also going to be offering the Thankful event. So it's kind of a fun opportunity for kids and families to come in and say what they're thankful for, and then we do a pie walk. So the kids get real competitive with that one. So like I said, the fun events, we usually offer 4 to possibly 6 in the summer when we're really busy. Events at the center, completely free for anyone to attend with littles or young ones under the age of 18. I will say for individuals, I know we have like grandmas in the room, maybe some moms. Grandmas can bring them too. If you're babysitting kids, you're more welcome to bring them to the events. It doesn't have to be their parents. So I just want to put that out there. Community initiatives. So we do a lot of stuff. Like I said, Firefly is our umbrella company. So there's the QR codes for community resource guides. We do a Safe Sleep initiative where we have the lone back crib information on a lot of different things around the community. You'll see them on pack and play, you'll see them on wipes, just different things like that. We also offer our parent cafe partnership along with Reid and Meridian. And then we also do Safe Sleep classes at the center. We do one every Monday. We're going to be doing one today in partnership with Reid. And then we also offer in Spanish twice a month. Another community initiative, we partnered with Purdue to offer our Garden to Table over the summer, which was an education series where we have a community garden at the center. Families help plant it, and then we harvest it all year, and then they can benefit from the produce that comes out of the garden. And then we had Purdue come in and tell them what to do with the food. Because we know a lot of people are like, what do I do with the zucchini? And I'm going to food banks and they're handing me zucchinis. I don't know what to do with zucchini. And we showed them fun, easy, delicious recipes, and then we had stuff there for them to try so they could actually get it in the moment and be like, this is good. And their kids could try it and know it's good. So it kind of offered them an opportunity to see the community garden, utilize what was in it, and then kind of have a practical practice for it once they got out. Our newest initiative we've been offering is FRC on the Road. So we take out our van and go to different community locations to outreach to families that may not be able to get to our 12th Street location. So we go to schools, libraries, we go out to Centerville, Hagerstown, Cambridge City, and take our stuff on the road so families have use for it when we're out and about. So that's one of our newer initiatives. Like I said, we do have a Spanish bilingual staff who helps at the center. She's there. She works at the school full-time, so she comes after school. She's there about 3:30 to 5 o'clock till 5:30 on Thursdays and helps with our Spanish-speaking families. And she does all of our events. She offers our safe sleep class, like I said, in Spanish. If you have any families that would benefit from her Spanish translation, she's great. People love her. She won the community award from Amigos this year for Partner of the Year, so she's just a great asset to the center. And that's pretty much the basic information about the center. So, of course, I'm thankful for everybody who's partnered with us, who's utilized the center, who continues to utilize the center. We're highly dependent on you and your needs, so thank you so much. That's our contact information. Does anybody have any questions? What now? No, it's on the folders. So does nobody have any questions? Okay, cool. Thank you.
We want to thank Sarah. One of the things, and we have 3, I'll make sure that we bring some next month, but these are really good. I keep this on my badge, so if people are interested, you can use the QR code and it tells you about various resources that are available in the community. And we use this a lot. We have one, I think we have one for Richmond and Wayne County and another one for the Connersville area. Okay, and also I need to make an announcement that Monday, October 27th at 11 a.m. will be the Medicare Annual Enrollment Education Session, and it will be in Vivian Auditorium in Whitewater Hall at IUE, sponsored through what Reid is going to be accepting this year. So it's Monday, October 27th at 11 a.m. Also, next month is our 16th anniversary. So we have some special prizes, and we're looking, and our speaker will be our Vice President, Jason Troutline, to share and give an update that's going on at Reid, and we hope to see you November 10th, I believe.